This brings me to Jayam Kannan, who is our evergreen champion. And I'm so proud to be, having her shoulder to lean on for so many of the events in which I need her help. And she's always the frontliner for me. So towards reaching the unreachable in the antenatal scenario, how far have we come with the DIPSI test? Because you are probably one of those who have assessed the maximum number of Manyata centers, and you would have recognized that when they started, they had no clue about this testing for hyperglycemia universally, nor doing the single step test. But when you actually assess them, they were all converts. So what has been your experience? And next I will come to Sushila Rani and Bhavatarni. Before that, we will again play a small video clip of Sheshaya sir. Jayam.
Yeah. Thanks to Dr. Sheshaya and Hema. I remember Sheshaya saying a couple of decades ago, 2 decades ago, I saw 2 obstetricians, young obstetricians, Sujata and Hema, standing on the side in a diabetes conference. And from that day onwards, Hema has never looked back on taking interest in diabetes in pregnancy. I'm very impressed with Anil Kapoor's words of 7 janmas and the doshams. And this is very true, especially for Sarva dosham. If you have this thing, they killed Naga Sarvam, this thing, king of the Sarvam, this thing curse falls on you for the next 7 generations. The same way, there should be some relation with the genetics, motive on this diabetes also. And Anil coming from an area of Brazil, which is 5.6 to 6% of diabetes in pregnancy. And we are in second in the world with 14.5 in diabetes in pregnancy. Karnataka, Tamil Nadu nearing more than 20% of diabetes coming into pregnancy. India need to check nearly 6 to 8 million diabetic women for diabetes in pregnancy. Are we able to reach all of them is the question. When after he gave the talk, I went into the primary health center, nurses, VHN, and looked at them. Government of India has said, give them 75 grams glucose and do the test. Are you doing it? To my surprise, I found no is the answer. Only when they just do the glucose test by the meter and they find the blood sugar is above 130, 140, they ask the pregnant woman come to the primary health center, and then after that they do the 75 grams glucose and 2 hours postprandial. This is one area where, in spite of our National Family Health Survey 4 boasting itself, doubling the antenatal visit, increasing the number of antenatal visits in the rural areas, still we are, in spite of our words, we are still lacking in this essential milestone. But of course, I won't be sorry to say that at least they have been tuned to do at least one glucose test, and from that pick up those people who a random blood sugar is a little high and take them to the hospital for doing a DIPSI test. By this, there has been a recent paper which you also would have seen in August 2022 in the Journal of Family of Clinical Medicine, that DIPSI is able to find out only 60%, 40% is missing. At least we are able to get 60%. Not, we are missing only 40. We are not missing 100%. In my practice in the last half a century, the number of stillbirths which I used to see earlier has remarkably come down after I insisted on doing the DIPSI at the first visit itself. That is a great change. And reaching the unreachable, yes, we have done to about 40%, but still we are yet to reach the rest of the 60% in the rural areas.
So, Jayam, what is your message to the rural women or women at large and the doctors, the general practitioners, family physicians, everybody practicing over there, whomever they can access, they will go to them. So, mass sensitization of them, test everybody and challenge them with sugar and test it. Can we give such a message to them so that they will start doing better than what they are? Or how do you plan to escalate this 40% to 100%?
100%. Once they find one complication in their pregnant women and the patient starts accusing with their fingers, indexing them, you did not test me for sugar. You made my baby to be lost. I developed hypertension because you did not find out that I am also a diabetic. When this indexing is coming up, definitely doctors will accept the challenge. And we have, in the next 2 decades, as Sheshaya has done in last 30 years, in the next 20, 30 years, if Hema continues to do this, probably this will be taken up in the rural areas of everywhere in India.
Thank you. Thank you. We always live with optimism and hope, and wherever possible, in whatever it takes, with all of you as champions, we are certainly.
Madam, that's too far. That's too far off.
20, 30 years sooner than rather than later.
Off.
उससे थोड़ा margin जास्त दिया है, but we will do it
in our 50s. Sheshaya is in his 80s. So that is why I said next to 30 years.
Okay.